CST Practice Test number 3, 1 to 175. Question 1. The structure that lies along the posterior border of the testis is the Option A, prostate. Option B, epididymis. Option C, tunica vaginalis. Option D, the ejaculatory duct. The correct answer is Option B, epididymis. The epididymis is a comma-shaped organ that lies along the posterior border of the testis. Question 2. The valve between the left atrium and left ventricle is the Option A, bicuspid. Option B, tricuspid. Option C, aortic semilunar. Option D, pulmonary semilunar. The correct answer is Option A, bicuspid. The valve between the left atrium and left ventricle is referred to as either the mitral or bicuspid valve. Question 3. What is the most abundant ion in the body? Option A, calcium. Option B, sodium. Option C, potassium. Option D, magnesium. The correct answer is Option A, calcium. Calcium is the most abundant ion in the body. Question 4. Which of the following is a method of bacterial survival when environmental conditions are not conducive to growth and viability? Option A, conjugation. Option B, transduction. Option C, spore formation. Option D, genetic mutation. The correct answer is Option C, spore formation. Spore formation happens when environmental conditions are not conducive to growth and viability. Question 5. What organ detects changes in the level of insulin and releases chemicals to regulate the level of blood glucose? Option A, liver. Option B, stomach. Option C, pancreas. Option D, gallbladder. The correct answer is Option C, pancreas. The pancreas regulates the concentration of sugar-glucose levels in the circulatory system. When the concentration of blood glucose increases, the pancreas senses the change and releases insulin, causing the glucose to move from the blood and be stored in the liver and muscles. When the blood level of glucose is too low, the pancreas releases glucagon that causes stored glucose to be released into the circulatory system. Question 6. What does the term strike-through mean? Option A, rupture of heat seal during sterilization. Option B, failure of biological indicator during sterilization. Option C, perforation of sharp object through sterile wrapper. Option D, soaking of moisture form unsterile to sterile layers. The correct answer is Option D, soaking of moisture form unsterile to sterile layers. When moisture soaks through a drape, gown or package, strike-through occurs and the item is contaminated. Question 7. Which of the following monitoring devices would be used within a vessel? Option A, ECG lead. Option B, Swan-Ganz. Option C, pulse oximeter. Option D, sphygmomanometer. The correct answer is Option B, Swan-Ganz. A Swan-Ganz monitoring device is inserted within a branch of the pulmonary artery to measure the central venous pressure, pulmonary artery pressure, pulmonary capillary wedge pressure and cardiac output. Question 8. When adding 30 ml of injectable saline to 30 ml of 0.5% marcaine, what strength does the drug become? Option A, 0.25%. Option B, 0.5%. Option C, 0.75%. Option D, 1%. The correct answer is Option A, 0.25%. 30 ml x 0.5% equals 60 ml x%. Question 9. What action should be taken if the patient has withdrawn the surgical informed consent prior to surgery? Option A, transport patient to OR, inform surgeon. Option B, do not transport patient, inform surgeon. Option C, do not transport patient, inform anesthesia provider. Option D, transport patient to OR, inform or supervisor. The correct answer is Option B, do not transport patient, inform surgeon. If a patient has withdrawn the surgical informed consent prior to surgery, then do not transport patient and inform the surgeon. Question 10. Confining and containing instruments with bioburden prevents which of the following? Option A, fomite formation. Option B, personnel injury. Option C, instrument loss. Option D, cross-contamination. The correct answer is Option D, cross-contamination. Cross-contamination is the contamination of an individual or object upon contact with a contaminated item. Question 11. The unsterile size of the perimeter of a sterile wrap is Option A, 1/2 inch. Option B, 1 inch. Option C, 2 inches. Option D, 3 inches. The correct answer is option B, 1 inch. The inside of wrappers is considered sterile except for the 1-inch border/perimeter around the outside edge of the wrapper. Question 12. A substance that inhibits the growth and reproduction of microbes on living tissue is A/N. Option A, antiseptic. Option B, disinfectant. Option C, sterilant. Option D, sporicidal. The correct answer is option A, antiseptic. Antiseptic agents are used to perform the patient's skin prep, as well as used by surgical team members to perform the surgical scrub. The agents are used to surgically clean the skin. Question 13. What action should be taken by the transporter if a discrepancy occurs in the identification of a patient in the nursing unit? Option A, try to locate family members to verify patient identity. Option B, transport to or and inform surgeon of discrepancy. Option C, inform unit clerk of discrepancy and return to or. Option D, do not transport, inform unit supervisor and or personnel. The correct answer is option D, do not transport, inform unit supervisor and or personnel. Do not transport, inform unit supervisor and or personnel if there is a discrepancy in the identification of a patient on the nursing unit. Question 14. A patient may be asked to shower at home with an antimicrobial soap before coming to the hospital for surgery to: Option A, achieve a cumulative antimicrobial effect. Option B, determine if the patient is allergic to the soap. Option C, reduce the amount of time for the pre-op prep. Option D, leave a visible film so the prep borders will show. The correct answer is option A, achieve a cumulative antimicrobial effect. Studies have shown patients that were asked to shower with antimicrobial soap at home prior to having surgery demonstrate a decrease in the microbial count on the skin. Question 15. What are the sequential steps performed prior to entrance into the sterile field? Option A, gown, glove, scrub. Option B, glove, scrub, gown. Option C, scrub, glove, gown. Option D, scrub, gown, glove. The correct answer is option D, scrub, gown, glove. Before donning the sterile gown and gloves, the sterile members of your team must perform the surgical scrub with a chemical antiseptic. Question 16. Which area is prepped last when preforming the skin prep for a Bartholin's cystectomy? Option A, anus. Option B, mons pubis. Option C, vagina. Option D, perineum. The correct answer is option A, anus. For prepping a Bartholin's cystectomy, the anus is prepped last. Question 17. The sterile surgical technologist should drape a table from: Option A, side to side. Option B, back to front. Option C, front to back. Option D, open drape, lay it down. The correct answer is option C, front to back. To avoid contamination and reaching over the non-sterile surface when draping a table, the drape should be placed front to back. Question 18. Which of the following can be injured if the arm is placed on the arm board greater than 90 degrees? Option A, brachial plexus. Option B, cervical plexus. Option C, rotator cuff. Option D, the acromioclavicular joint. The correct answer is option A, brachial plexus. If the arm is placed on the arm board at greater than 90 degrees, the brachial plexus is at risk for injury. Question 19. What is the purpose of the third lumen in a three-way indwelling flowy catheter? Option A, obtain urine specimen. Option B, instill irrigation fluids. Option C, provide hemostasis. Option D, prevent urine reflux. The correct answer is option B, instill irrigation fluids. The third lumen of the three-way indwelling Foley catheter is used for purposes of instilling irrigating fluids into the bladder. Question 20. Which of the following enlarges and illuminates the surgical field during cataract procedures? Option A, fluorescent overhead lights. Option B, fiber optic headlamps. Option C, operating microscope. Option D, surgical loops. The correct answer is option C, operating microscope. Operating microscope enlarges and illuminates the surgical field. Question 21. Small radiopaque surgical patties used during cranial procedures are: Option A, rakes. Option B, Kittners. Option C, Pledgets. Option D, cotonoids. The correct answer is option D, cotonoids. Cotonoids are small radiopaque surgical patties used during cranial procedures. Question 22. Which of the following hemostatic agents must be applied dry and only handled with dry gloves and instruments? Option A, oxyseal. Option B, avatine. Option C, gelfam. Option D, athrombin. The correct answer is option B, avatine. Avatine is a type of collagen material which must be kept dry or it becomes very sticky and difficult to handle. Question 23. Which surgical specialty would utilize a phacoemulsification machine? Option A, neurosurgery. Option B, maxillofacial. Option C, ophthalmology. Option D, otorinolaryngology. The correct answer is option C, ophthalmology. Phacoemulsification machine uses ultrasonic energy to fragment the lens while it irrigates and aspirates the fragments in ophthalmology surgery. Question 24. Which of the following lasers would be contraindicated for use in the posterior chamber of the eye? Option A, argon. Option B, dexamer. Option C, HO-YAG. Option D, carbon dioxide. The correct answer is option D, carbon dioxide. Carbon dioxide laser would be contraindicated for the use in the posterior chamber of the eye because the laser beam cannot travel through clear fluids. Question 25. In which structure of the heart are the leads for permanent pacemaker placed? Option A, right ventricle. Option B, left ventricle. Option C, septum. Option D, aorta. The correct answer is option A, right ventricle. The endocardial electrode is placed in the right ventricle or atrium. Question 26. For which of the following diagnoses would a patient require pancreaticojejunostomy? Option A, gastroschisis. Option B, morbid obesity. Option C, neonatal jaundice. Option D, alcoholic pancreatitis. The correct answer is option D, alcoholic pancreatitis. To relieve pain caused by chronic alcoholic pancreatitis and pseudocysts of the pancreas, a pancreaticojejunostomy may be performed. Question 27. In which procedure would a Buckwalter retractor be used? Option A, cystectomy. Option B, nephrectomy. Option C, retropubic prostatectomy. Option D, transurethral prostatectomy. The correct answer is option C, retropubic prostatectomy. Buckwalter retractor may be used for a retropubic prostatectomy. Question 28. Which cranial nerve is severed as a last resort treatment of Meniere's disease? Option A, 7. Option B, 8. Option C, 9. Option D, Vex. The correct answer is option B, 8. Meniere's disease is associated with cranial nerve 8. Question 29. Brachytherapy is performed to treat option A, uterine prolapse. Option B, endometriosis. Option C, cervical cancer. Option D, menorrhagia. The correct answer is option C, cervical cancer. Brachytherapy is used in the treatment of cervical cancer. Question 30. Which procedure is performed to improve the vision of patients with myopia? Option A, radial keratotomy. Option B, scleral buckling. Option C, keratoplasty. Option D, vitrectomy. The correct answer is option A, radial keratotomy. Radial keratotomy is a procedure performed to improve vision for patients with myopia. Question 31. The facial fracture that involves the complete separation of the maxilla from the cranial base is aslation. Option A, orbital floor. Option B, zygomatic. Option C, Lafort eye. Option D, frontal sinus. The correct answer is option C, Lafort eye. Lafort eye fracture is a type of midfacial fracture in which the maxilla is separated from the base of the skull and the upper jaw can be free-floating. Question 32. What is the name of this retractor? Option A, Charnley. Option B, Bennett. Option C, Harrington. Option D, Richardson. The correct answer is option B, Bennett. Bennett retractors are frequently used in various types of orthopedic procedures. Question 33. Where is the incision for a Caldwell loop procedure made? Option A, canine fossa. Option B, frontal sinus. Option C, eyebrow. Option D, tear duct. The correct answer is option A, canine fossa. Caldwell loop procedure involves an incision into the canine fossa of the upper jaw. Question 34. The device used for real-time intraoperative assessment of blood flow is Slashin. Option A, caliper. Option B, Doppler. Option C, pacemaker. Option D, manometer. The correct answer is option B, Doppler. A Doppler device measures the movement of blood through a vessel using ultrasonic, high-frequency waves. Question 35. The needle holder shown below would be used during A. Option A, vaginal hysterectomy. Option B, repair of rotator cuff. Option C, tonsillectomy. Option D, craniotomy. The correct answer is option D, craniotomy. The Castroviejo needle holder is a type of microsurgical instrument used during delicate cardiothoracic and vascular procedures and neurosurgery. Question 36. A chemical reaction that provides energy by the breakdown of food is option A, anabolism. Option B, catabolism. Option C, metabolism. Option D, commensalism. The correct answer is option B, catabolism. The chemical reactions that break down complex organic compounds into simple ones are known as catabolism. Question 37. Which structure of the ear is responsible for equilibrium? Option A, semicircular canals. Option B, cranial nerve V. Option C, labyrinth. Option D, cochlea. The correct answer is option A, semicircular canals. The semicircular canals work to maintain the equilibrium of the body. Question 38. The first step urine production when fluids and dissolved substances are forced through a membrane by pressure is called option A, tubular secretion. Option B, tubular reabsorption. Option C, glomerular filtration. Option D, glomerular absorption. The correct answer is option C, glomerular filtration. The first step in the production of urine is called glomerular filtration. Question 39. The adipose tissue overlying the symphysis is the option A, labia majora. Option B, mons pubis. Option C, perineum. Option D, vestibule. The correct answer is option B, mons pubis. The elevated adipose tissue over the symphysis is called the mons pubis. Question 40. The cranial nerve that regulates secretion of gastric juice is the option A, 3. Option B, V. Option C, 7. Option D, X. The correct answer is option D, X. The vagus cranial nerve, X, regulates the secretion of gastric juices. Question 41. Phagocytosis by the white blood cells is an example of which line of defense? Option A, first. Option B, second. Option C, third. Option D, fourth. The correct answer is option B, second. Phagocytosis by the white blood cells is an example of the body's second line of defense. Question 42. When opening a sterile wrapper, the unsterile person should open the first corner. Option A, away from self. Option B, towards self. Option C, to the right. Option D, to the left. The correct answer is option A, away from self. When opening a sterile wrapper, the unsterile person should open the corner farthest from the body first. The unsterile person must avoid reaching over a sterile field. Question 43. Which of the following is the least inert of the synthetic meshes? Option A, PTFE. Option B, polypropylene. Option C, polyester fiber. Option D, polyglactin 910. The correct answer is option C, polyester fiber. Polyester fiber mesh is one of the least inert of the synthetic meshes. Question 44. What radiopaque contrast medium is used intraoperatively when the patient is allergic to iodine? Option A, isovu. Option B, rhinographin. Option C, methylene blue. Option D, indigo carmine. The correct answer is option B, rhinographin. Rhinographin is used when a patient is allergic to iodine. Question 45. Which of the following legal terms would apply to a case when a non-English speaking patient signs a surgical informed consent in English, but does not fully understand it? Option A, assault and battery. Option B, residential ipsa loquitur. Option C, respondeat superior. Option D, negligence. The correct answer is option A, assault and battery. If a non-English speaking patient signs a surgical informed consent in English and does not fully understand it, assault and battery would apply to the situation. Question 46. Which of the following psychosocial factors is important for RHTE surgical team to address for pediatric patients? Option A, reliance on others. Option B, postoperatively schedule. Option C, separation anxiety. Option D, appearance of scar. The correct answer is option C, separation anxiety. A fear that most pediatric patients experience is anxiety due to impending separation from the parents. Question 47. What is the surgical technologist's role during the transfer of the patient from the OR bed to the stretcher? Option A, completes counts and signs the OR record. Option B, maintains sterility and integrity of back table. Option C, begins breakdown of sterile setup after drapes removed. Option D, does not remove sterile attire, but aids in patient transfer. The correct answer is option B, maintains sterility and integrity of back table. The scrub person should remain sterile and maintain the sterility of the back table until the patient has left the OR. If any complications should occur in the immediate postoperative period in the OR, the scrub person is prepared to assist. Question 48. When breaking down the sterile field, the surgical technologist should place the grossly contaminated instruments in which of the following? Option A, biohazardous bag. Option B, mesh-bottomed flash pan. Option C, basin with sterile saline. Option D, basin with sterile water. The correct answer is option D, basin with sterile water. The dirty instruments should be placed in a basin of water for transport to the decontamination room. Saline will damage the coating on the instruments. The instruments should not be transferred dry to the decontamination room, allowing the debris to dry, making it difficult to clean. Question 49. How many minutes are unwrapped instruments with no lumens sterilized at 270 degrees Fahrenheit? Option A, 3. Option B, 6. Option C, 9. Option D, 12. The correct answer is option A, 3. Instruments that are unwrapped with no lumens can be sterilized at 270 degrees Fahrenheit for 3 minutes. Question 50. Which characteristic describes an amphiarthrosis? Option A, hinge. Option B, immobile. Option C, slightly movable. Option D, freely movable. The correct answer is option C, slightly movable. An amphiarthrosis refers to a joint that is slightly movable, such as the symphysis pubis. Question 51. What is the recommended method of hair removal from an operative site? Option A, wet shave with disposable razor. Option B, cream depilatory 2 days pre-op. Option C, clippers with disposable heads. Option D, dry shave with straight razor and tape. The correct answer is option C, clippers with disposable heads. If a shave is ordered, studies show that the best method is to use clippers with disposable heads to try to prevent cutting or nicking the skin. Question 52. Which of the following must be in the chart prior to the patient being taken to the OR per the Joint Commission? Option A, incident report. Option B, advance directive. Option C, insurance authorization. Option D, history and physical. The correct answer is option D, history and physical. Certain information and results of tests should be found in the patient's chart, such as lab results, radiology reports, consent form for surgery, previous pathology reports, history and physical reports, allergies, handicaps or other limitations. Question 53. An identification bracelet is placed on a surgical patient upon admission to the Option A, facility. Option B, nursing unit. Option C, pre-op care unit. Option D, surgery department. The correct answer is option A, facility. Upon admission to the facility, the identification bracelet is placed on the surgical patient. Question 54. To maintain control of the stretcher, the patient should be transported to the OR. Option A, according to surgeon's orders. Option B, based on patient's request. Option C, head first. Option D, feet first. The correct answer is option D, feet first. To allow the individual transporting the patient the ability to control the stretcher and the patient facing in a normal position, the patient is to be transported feet first at all times. Question 55. At what point is it appropriate to lower the leg when draping for a knee arthroscopy? Option A, after the tourniquet has been inflated. Option B, before the tourniquet has been deflated. Option C, after the prep is completed. Option D, before exsanguination. The correct answer is option A, after the tourniquet has been inflated. After the tourniquet has been inflated, the leg may be lowered when draping for a knee arthroscopy. Question 56. Which structure regulates the amount of light entering the eye? Option A, pupil. Option B, virus. Option C, retina. Option D, cornea. The correct answer is option B, iris. The iris regulates the amount of light entering the eye and assists in obtaining a clear image. Question 57. A capillary network of blood vessels within the renal cortex that functions as a filter is called the Option A, loop of Henle. Option B, renal papillae. Option C, glomerulus. Option D, nephron. The correct answer is option C, glomerulus. The glomerulus is a capillary network of blood vessels within the renal cortex that functions as a filter. Question 58. The kidneys are located in the Option A, pelvic cavity. Option B, thoracic cavity. Option C, space of Retzius. Option D, retroperitoneal space. The correct answer is option D, retroperitoneal space. Since the kidneys are located behind the peritoneal lining of the abdominal cavity, they are retroperitoneal organs. Question 59. The most abundant extracellular ion necessary for the transmission of impulses is Option A, sodium. Option B, calcium. Option C, chloride. Option D, potassium. The correct answer is option A, sodium. Sodium is the most abundant extracellular ion necessary for the transmission of impulses. Question 60. The set of teeth that erupt at about 6 months of age and are later replaced are the Option A, secondary dentition. Option B, deciduous teeth. Option C, third molars. Option D, bicuspids. The correct answer is option B, deciduous teeth. Deciduous teeth, baby teeth, erupt at about 6 months of age and are lost usually between 6 and 12 years of age. Question 61. What is a frequently used barbiturate for general anesthesia induction? Option A, propofol. Option B, ketamine. Option C, thiopental. Option D, lorazepam. The correct answer is option C, thiopental. Thiopental sodium, pentothal, is commonly used induction drug. Question 62. Which of the following arteries does not arise directly from the aorta? Option A, celiac. Option B, vertebral. Option C, superior mesenteric. Option D, left common carotid. The correct answer is option B, vertebral. The celiac, mesenteric, and common carotid arteries arise directly from the aorta. The vertebral arteries arise from the subclavian arteries. Question 63. How long must an item be immersed in glutaraldehyde to be sterile? Option A, 10 minutes. Option B, 90 minutes. Option C, 6 hours. Option D, 10 hours. The correct answer is option D, 10 hours. To be considered sterile, an item must be completely submerged in glutaraldehyde for 10 hours. Question 64. Which chemical substance causes the immune system to form antibodies? Option A, antigens. Option B, interferons. Option C, complements. Option D, immunoglobulins. The correct answer is option A, antigens. Antigens are chemical substances that react with the body and cause the formation of antibodies. Question 65. What is a surgical procedure for the treatment of acute otitis media? Option A, myringotomy. Option B, stapedectomy. Option C, mastoidectomy. Option D, tympanoplasty. The correct answer is option A, myringotomy. Myringotomy is an incision into the tympanic membrane in order to suction the infectious fluids and place PE tubes. This is performed for the treatment of chronic acute otitis media. Question 66. How is the patient positioned on the table for a knee arthroscopy? Option A, Trendelenburg, knee over center break. Option B, lateral, hip over lower break. Option C, supine, knee at lower break. Option D, low lithotomy, body centered. The correct answer is option C, supine, knee at lower break. The patient is placed in the supine position with the knees placed at the lower break of the table. The end of the table is lowered to facilitate moving the operative leg during the arthroscopy. Question 67. Which of the following instrument sets will be needed when a frontal sinus fracture repair is performed? Option A, plastic. Option B, craniotomy. Option C, ophthalmic. Option D, vascular. The correct answer is option B, craniotomy. A craniotomy approach is often used for frontal sinus repair requiring the use of craniotomy instruments. Question 68. Which of the following procedures is performed for cervical incompetence? Option A, choledocentesis. Option B, colporrhaphy. Option C, Werthiam. Option D, Sherode-Kerr. The correct answer is option D, Sherode-Kerr. The placement of a collar suture at the interval cervical OS to prevent spontaneous abortion is called a Sherode-Kerr procedure. Another term for the procedure is sucklage and involves the placement of polyester, merzylene, tape around the internal OS and tied. Question 69. What surgical instrument is used to visualize the prostate and remove tissue during a TURP? Option A, Votus urethrotomy. Option B, Van Buren sounds. Option C, a resectoscope. Option D, ureteroscope. The correct answer is option C, resectoscope. The resectoscope is a combination of a cutting instrument and an endoscope. The surgeon utilizes a loop electrode that excises the prostatic tissue, and the endoscope provides visualization of the prostate. Question 70. Which of the following facilitates exposure for thyroidectomy? Option A, interscapular pillow. Option B, lateral rotation. Option C, Mayfield head holder. Option D, reverse Trendelenburg. The correct answer is option A, interscapular pillow. Several types of devices can be used to hyperextend the neck, such as a shoulder roll or interscapular pillow. Question 71. Which of the following needles would used for a liver biopsy? Option A, STEMI. Option B, Uvers. Option C, TrueCut. Option D, interstitial. The correct answer is option C, TrueCut. A TrueCut biopsy needle would be used for obtaining a liver tissue biopsy. Question 72. Why is cardioplegia used? Option A, inhibit blood vessel spasm. Option B, cause diastolic arrest. Option C, increase force of contraction. Option D, correct acidosis. The correct answer is option B, cause diastolic arrest. Cardioplegia is used during some open heart procedures to arrest the heart and allow the surgeon the ability to perform the procedure. Question 73. What is the risk if a tourniquet is inflated for a prolonged period of time? Option A, tissue necrosis. Option B, hematoma formation. Option C, hypotension. Option D, tetany. The correct answer is option A, tissue necrosis. Tissue necrosis can occur if the tourniquet is inflated for a prolonged period of time. Question 74. What type of specialty equipment uses liquid nitrogen and is often utilized to repair retinal detachments? Option A, NESAT. Option B, CUSA. Option C, nerve stimulator. Option D, cryotherapy. The correct answer is option D, cryotherapy. The cryotherapy unit uses liquid nitrogen to deliver extreme cold through an insulated probe to the diseased tissue without damaging the adjacent tissues and is often used to repair retinal detachments. Question 75. What is done to the umbilicus during the abdominal skin prep? Option A, dabbed with first foam sponge only. Option B, not prepped to prevent contamination. Option C, prepped separately with cotton applicators. Option D, filled with prep solution and left pooled. The correct answer is option C, prepped separately with cotton applicators. The umbilicus is prepped last or separately since it is considered a contaminated area. Question 76. An axillary roll is placed for lateral positioning to: Option A, aid venous return. Option B, facilitate respiration. Option C, create good body alignment. Option D, allow access to incision site. The correct answer is option B, facilitate respiration. An axillary roll is placed for lateral positioning to facilitate respiration. Question 77. Which nerve could be damaged by improperly padded stirrups? Option A, tibial. Option B, sciatic. Option C, gluteal. Option D, peroneal. The correct answer is option D, peroneal. The peroneal nerve innervates the lateral surface of the lower leg and dorsal surface of the foot. The straps of the stirrups that hold the foot in place, if improperly positioned or inadequately padded, can cause undue pressure on the nerve, causing temporary or permanent damage. Question 78. Frozen sections are sent to pathology. Option A, immediately without preservative. Option B, immediately with preservative. Option C, end of case with preservative. Option D, end of case without preservative. The correct answer is option A, immediately without preservative. Formalin or normal saline will alter the tissue that is indicated for frozen sections. Therefore, the tissue must be sent in a container with no preservative. Question 79. Which of the following procedures would be performed with the patient in the lateral position? Option A, suprapubic prostatectomy. Option B, vaginal hysterectomy. Option C, nephrectomy. Option D, tonsillectomy. The correct answer is option C, nephrectomy. For nephrectomy, the patient is positioned in the lateral position, non-operative site down. Question 80. Which heat-resistant, spore-forming bacillus does the steam sterilization biological indicator contain? Option A, S. aureus. Option B, B. tetani. Option C, E. coli. Option D, G. stearothermophilus. The correct answer is option D, G. stearothermophilus. The biological indicator for steam sterilization contains the B. stearothermophilus spore. It is harmless to humans, but is highly resistant to destruction by steam sterilization. Question 81. The process by which blood cells are formed is known as Option A, erythropoiesis. Option B, hemopoiesis. Option C, diapedesis. Option D, leukocytosis. The correct answer is option B, hemopoiesis. Hemopoiesis is the process by which blood cells are formed. Question 82. The pacemaker of the heart is /are the Option A, SA node. Option B, AV node. Option C, Purkinje fibers. Option D, bundle of His. The correct answer is option A, SA node. The sinoatrial, SA, node establishes the rhythm of the heart. Question 83. Thought processes take place in the Option A, midbrain. Option B, cerebellum. Option C, cerebral cortex. Option D, foramen magnum. The correct answer is option C, cerebral cortex. The cerebral cortex, where thought processes occur, is located on the surface of the cerebrum and contains billions of neurons. Question 84. Cantorix, bacitracin or Ansef mixed with saline for irrigation would do which of the following? Option A, minimize vasospasm. Option B, prevent clot formation. Option C, reduce adhesions formation. Option D, inhibit surgical site infection. The correct answer is option D, inhibit surgical site infection. Cantorix, bacitracin and Ansef are antibiotics that are mixed with saline irrigation for purposes of irrigating the surgical wound to prevent a surgical site infection. Question 85. Which of the following sterilizers operates with condition, exposure, exhaust and dry cycles? Option A, gravity air displacement. Option B, per vacuum steam. Option C, hydrogen peroxide. Option D, activated glutaraldehyde. The correct answer is option A, gravity air displacement. Gravity displacement sterilizers have 4 cycles: condition, exposure, exhaust and dry. Question 86. Preoperative bladder drainage prior to AD and C would be preformed with which of the following catheters? Option A, 16 FR Foley. Option B, 14 FR Robinson. Option C, 10 FR Pezzer. Option D, 8 FR Malacot. The correct answer is option B, 14 FR Robinson. 14 FR Robinson should be used prior to AD and C. Question 87. In the OR, HEPA is a type of Option A, air filter. Option B, laminar flow. Option C, suction device. Option D, gas outlet. The correct answer is option A, air filter. HEPA filters are used in the OR due to the ability to remove bacteria as small as 0.5 to 5 millimeters. Question 88. What precaution is utilized to prevent cardiovascular complications when positioning an anesthetized patient? Option A, maintain neutral alignment. Option B, pad bony prominences. Option C, move patient slowly. Option D, uncross legs or ankles. The correct answer is option C, move patient slowly. An anesthetized patient should be moved slowly to allow the cardiovascular system to adjust due to the preoperative and intraoperative drugs the patient has received that affect the system. Question 89. Why is the orientation of the vein graft reversed during a CABG? Option A, thickness of tunica intima. Option B, prevent atherosclerosis. Option C, reduce vascular flow. Option D, presence of valves. The correct answer is option D, presence of valves. The valves within the lumen of the saphenous vein can prevent the flow of blood, therefore, the vein must be reversed when used during a CABG. Question 90. Which of the following neurosurgical retractors is handheld? Option A, Greenberg. Option B, Cushing. Option C, Layla. Option D, Beckman. The correct answer is option B, Cushing. Cushing is handheld neurosurgical retractor. Question 91. Which of the following incisions may be used for the repair of a zygomatic fracture? Option A, below lower eyelid. Option B, coronal. Option C, angle of the mandible. Option D, preauricular. The correct answer is option A, below lower eyelid. For zygomaticomaxillary and zygomaticofrontal suture fractures, the incision is placed below the lower eyelid. Question 92. The principal male hormone produced in the testes is option A, inhibin. Option B, prolactin. Option C, aldosterone. Option D, testosterone. The correct answer is option D, testosterone. Testosterone is the principal male hormone produced in the testes and responsible for sexual characteristics. Question 93. All of the following statements are true for paper plastic peel packs, except option A, felt tip markers should only be used on the plastic side of pack. Option B, latex tubing should not be used to protect tip of instruments. Option C, staples are an acceptable method of closing peel packs. Option D, inner pack of a double peel packed item should not be sealed. The correct answer is option C. Staples are an acceptable method of closing peel packs. Staples must not be used to seal a peel pack. The staples create small holes that create an opening for microbes to enter. Question 94. Following a TURP, a patient may have which of the following placed for bladder irrigation and compression? Option A, T-tube. Option B, three-way Foley. Option C, Robinson. Option D, Jackson-Pratt. The correct answer is option B, three-way Foley. A three-way Foley may be placed following a TURP. Question 95. Which of the following is a correct statement when using the closed gloving technique? Option A, circulator assists with gloving. Option B, hand must not extend beyond cuffs. Option C, fingers of glove are pointed away from elbow. Option D, glove is positioned palm up to facilitate pulling on. The correct answer is option B, hand must not extend beyond cuffs. For closed gloving, the hand must not extend beyond cuffs. Question 96. What drainage device is preferred for a radical neck dissection? Option A, T-tube. Option B, Penrose. Option C, Malacot. Option D, Jackson-Pratt. The correct answer is option D, Jackson-Pratt. A Jackson-Pratt drain is preferred for a radical neck dissection when a moderate amount of drainage is expected. Question 97. Which arteries are formed by the bifurcation of the abdominal aorta? Option A, femoral. Option B, renal. Option C, mesenteric. Option D, iliac. The correct answer is option D, iliac. The iliac arteries are formed by the bifurcation of the abdominal aorta. Question 98. The basic unit of the nervous system is the option A, neuron. Option B, glial cell. Option C, neurolemma. Option D, Schwann cell. The correct answer is option A, neuron. The basic unit of the nervous system is the neuron. Question 99. The correct sterilization times required to render specific items sterile are initially established by the option A, healthcare facility policies. Option B, equipment manufacturer. Option C, surgeon's preference. Option D, CDC. The correct answer is option B, equipment manufacturer. The sterilization time for an item, S, is established by consulting the manufacturer's recommendations. Question 100. What procedure involves a series of treatments that result in permanent placement of prosthetic teeth? Option A, Lafort 2. Option B, odontectomy. Option C, orthognathic. Option D, dental implants. The correct answer is option D, dental implants. Dental implants is a series of treatments that result in a placement of a prosthetic tooth. Question 101. In addition to temperature, time, and moisture, what other factor determines the outcome of the steam sterilization process? Option A, weight. Option B, aeration. Option C, pressure. Option D, concentration. The correct answer is option C, pressure. The four factors that are important to the steam sterilization process to ensure all microbes are destroyed are temperature, pressure, moisture, and air. Question 102. The inner lining of the uterus is the option A, perineum, option B, peritoneum, option C, myometrium, option D, endometrium. The correct answer is option D, endometrium. The inner layer of the uterus is the endometrium, the outer layer is the perimetrium, and the middle layer is the myometrium. Question 103. Which of the following sterilization processes is most economical? Option A, gas, option B, steam, option C, liquid chemical, option D, ionizing radiation. The correct answer is option B, steam. Steam sterilization is the most economical and least expensive method of sterilization. Question 104. The basic, living structural and functional unit of the body is known as the option A, organism, option B, tissue, option C, organ, option D, cell. The correct answer is option D, cell. The basic functional unit of the body that makes up tissues and organs is the cell. Question 105. The roof of the mouth is formed by the option A, filiform papillae, option B, palatoglossal arch, option C, hard and soft palates, option D, a circumvallate papillae. The correct answer is option C, hard and soft palates. The hard and soft palates form the roof of the mouth. Question 106. In what position would a patient be placed following a tonsillectomy? Option A, sitting, option B, lateral, option C, Trendelenburg, option D, reverse Trendelenburg. The correct answer is option B, lateral. Postoperatively, a patient is placed in lateral position to prevent aspiration of blood and venous engorgement. Question 107. What classification of drug reduces tissue inflammation? Option A, steroids, option B, antibiotics, option C, antiemetics, option D, sulfonamides. The correct answer is option A, steroids. Steroids are a type of drug that reduce tissue inflammation and swelling. Question 108. What is the result of adding epinephrine to a local anesthetic? Option A, prevent clotting, option B, inhibit infections, option C, decrease heart rate, option D, prolong anesthetic effect. The correct answer is option D, prolong anesthetic effect. When added to a local anesthetic, epinephrine prolongs the anesthetic effect since it is a vasoconstrictor. Question 109. Which of the following is not a type of sterilizing agent? Option A, cobalt-60, option B, boiling water, option C, steam under pressure, option D, activated glutaraldehyde. The correct answer is option B, boiling water. The destruction of microbes including spores can be accomplished with steam under pressure, chemical agents such as ethylene oxide, electron bombardment, or ultraviolet radiation. Question 110. A diagnostic procedure performed for patients with possible prostatic cancer is known as A. Option A, needle biopsy, option B, TURP, option C, CUB, option D, cystostomy. The correct answer is option A, needle biopsy. A prostatic needle biopsy is a diagnostic procedure performed when prostatic cancer is suspected. Question 111. How many hours is the steam biological indicator incubated? Option A, 4, option B, 6, option C, 12, option D, 24. The correct answer is option D, 24. The steam biological indicator that was put through the steam sterilization process is incubated for 24 hours before the reading is recorded. Question 112. What agent is used to flush the harvested saphenous vein during a CABG? Option A, thrombin, option B, bacitracin, option C, heparinized saline, option D, potassium chloride. The correct answer is option C, heparinized saline. The saphenous vein is flushed with heparinized saline to identify branches that may have been missed. Question 113. In which of the following cases might the surgeon use a Gilly saw? Option A, craniotomy, option B, corpectomy, option C, cranioplasty, option D, chordotomy. The correct answer is option A, craniotomy. The Gilly saw is used during a craniotomy. It is included in a basic neurologic instrument set. Question 114. Low-level disinfectants kill most microbes, but typically do not destroy. Option A, viruses. Option B, bacteria. Option C, fungi. Option D, spores. The correct answer is option D, spores. Low-level disinfecting agents kill most bacteria, fungi and viruses, but they are not effective in destroying spores and M. tuberculosis. Question 115. Polymethyl methacrylate would most likely be used on which of the following procedures? Option A, intramedullary nailing. Option B, total knee arthroplasty. Option C, triple arthrodesis. Option D, percutaneous pinning. The correct answer is option B, total knee arthroplasty. Polymethyl methacrylate, also known as bone cement, is used for a total joint arthroplasty performed on the knee and hip. Question 116. Which of the following items should not be sterilized by dry heat? Option A, oil. Option B, powder. Option C, a linen packs. Option D, petroleum gauze. The correct answer is option C, linen packs. Dry heat is a type of sterilization process used for sterilizing oils, powders and petroleum gauze that will be used in surgery. Question 117. What is a Ver's needle used for during a laparoscopy? Option A, instill CO2. Option B, the aspirate fluid. Option C, collect a specimen. Option D, the cyst in trocar site closure. The correct answer is option A, instill CO2. The pneumoperitoneum is established by inserting a Ver's needle. Tubing from the needle is attached to the insufflator for the instillation of carbon dioxide. Question 118. Which method uses ultrasonic energy to fragment the lens? Option A, diathermy. Option B, cryotherapy. Option C, irrigation/aspiration. Option D, phacoemulsification. The correct answer is option D, phacoemulsification. Phacoemulsification uses ultrasonic energy to fragment the lens. Question 119. In which of the following procedures would fine hooks of various angles be used? Option A, myringotomy. Option B, tonsillectomy. Option C, stapedectomy. Option D, tympanotomy. The correct answer is option C, stapedectomy. Fine hooks available in varying angles are essential dissecting instruments to perform a stapedectomy. Question 120. Which incisional approach would be used for a splenectomy? Option A, Pfannenstiel. Option B, right subcostal. Option C, left subcostal. Option D, supraumbilical. The correct answer is option C, left subcostal. Incisions commonly used for splenectomy include left subcostal, left paramedian, and midline. Question 121. During a strabismus correction, resection has a greater effect on which muscle? Option A, superior rectus. Option B, inferior rectus. Option C, medial rectus. Option D, lateral rectus. The correct answer is option D, lateral rectus. When performing a resection for the correction of strabismus, a portion of the lateral rectus muscle is excised, at the two ends reanastomosed. Question 122. What is the best site for obtaining cortical bone graft? Option A, iliac crest. Option B, ischial spine. Option C, femoral head. Option D, symphysis pubis. The correct answer is option A, iliac crest. The iliac crest, the superior portion of the ilium that flares outward, is an excellent source of cancellous and cortical bone for grafting purposes. Question 123. Which of the following is a non-electrolytic and isotonic solution used during a TURP? Option A, saline. Option B, distilled water. Option C, glycine. Option D, Ringer's lactate. The correct answer is option C, glycine. Glycine is a non-electrolytic and isotonic solution that is used during a TURP. Since it is non-electrolytic, it can be used in conjunction with the resectoscope. Question 124. The structure that allows the eardrum to vibrate freely and connects the middle ear and the oropharynx is the Option A, external auditory canal. Option B, eustachian tube. Option C, semicircular canal. Option D, internal auditory meatus. The correct answer is option B, eustachian tube. The eustachian tube connects the middle ear with the nasopharynx of the throat. It ensures that the eardrum vibrates freely when struck by sound waves. Question 125. Which of the following procedures may require use of a manometer to check CSF pressure? Option A, transsphenoidal hypophysectomy. Option B, intracranial aneurysm clipping. Option C, posterior fossa decompression. Option D, ventriculoperitoneal shunt. The correct answer is option D, ventriculoperitoneal shunt. A ventriculoperitoneal shunt is a procedure that may require the use of a manometer to keep track of the intraoperative CSF pressure. Question 126. Which cranial nerve is affected by trigeminal neuralgia? Option A, I. Option B, V. Option C, 6. Option D, 7. The correct answer is option B, V. Trigeminal neuralgia arises from the irritation of the fifth cranial nerve. Question 127. What is used to lubricate the donor site and reduce friction form the dermatome? Option A, bacitracin ointment. Option B, iodophor solution. Option C, petrolatum gel. Option D, mineral oil. The correct answer is option D, mineral oil. Sterile mineral oil is used to lubricate the skin at the donor site to reduce friction and provide a smooth surface for the dermatome. Question 128. Which of the following is an example of proper sterile technique when performing the prep for a split-thickness skin graft? Option A, donor site first. Option B, recipient site first. Option C, donor site only. Option D, recipient site only. The correct answer is option A, donor site first. Donor site first is an example of proper sterile technique when performing the skin prep for a split-thickness skin graft. Question 129. What is the recommended range of intra-abdominal pressure in an adult patient when using an insufflator during a laparoscopic procedure? Option A, 8 to 11 mm Hg. Option B, 12-15 mm Hg. Option C, 16 to 19 mm Hg. Option D, 20 to 23 mm Hg. The correct answer is option B, 12-15 mm Hg. The intra-abdominal pressure of the carbon dioxide should be maintained between 12 to 15 mm Hg to avoid damage to the abdomen. However, it should not be allowed to go below 8 mm Hg. Question 130. Which of these terms refers to the inability to direct both eyes at the same object? Option A, strabismus. Option B, chalazion. Option C, glaucoma. Option D, cataract. The correct answer is option A, strabismus. Strabismus is the inability to direct both eyes at the same object due to the lack of coordination of the extraocular muscles. Question 131. What procedure is performed to correct chronic cerebral ischemia? Option A, rhizotomy. Option B, cranioplasty. Option C, arteriography. Option D, endarterectomy. The correct answer is option D, endarterectomy. Indications for a carotid endarterectomy include transient cerebral ischemia, asymptomatic Brught's, and chronic cerebral ischemia. Question 132. According to the rule of nines, what percentage is assigned to the front and back of the trunk? Option A, 27%. Option B, 18%. Option C, 4.5%. Option D, 1%. The correct answer is option B, 18%. According to the rule of nines, the percentage assigned to the front and back of the trunk of the body is 18%. Question 133. Which term refers to the abnormal increase in the number of cells? Option A, atrophy. Option B, dysplasia. Option C, hyperplasia. Option D, hypertrophy. The correct answer is option C, hyperplasia. An abnormal increase in the number of cells due to an increase in the frequency of cell division is known as hyperplasia. Question 134. A second intention wound heals by Option A, granulation. Option B, evisceration. Option C, primary union. Option D, delayed suturing. The correct answer is option A, granulation. During second intention healing, granulation tissue containing fibroblasts forms in the wound and closes it by contraction with secondary growth of epithelium. Question 135. Intraoperative ventricular arrhythmias are treated with Option A, lidocaine. Option B, DG toxin. Option C, prostagmin. Option D, furosemide. The correct answer is option A, lidocaine. Lidocaine hydrochloride, trade name xylocaine, is used as an emergency medication during surgery to treat cardiac arrest or ventricular tachycardia or fibrillation. Question 136. How many milliliters equal to 2 ounces? Option A, 40. Option B, 50. Option C, 60. Option D, 70. The correct answer is option C, 60. 1 fluid ounce equals 30 ml, 2 ounces equals 60 ml. Question 137. Covering a sterile back table for later use is: Option A, permissible for up to 1 hour before the procedure. Option B, permissible in instances of an emergency. Option C, not permissible for up to 2 hours before the procedure. Option D, not permissible under any circumstances. The correct answer is option D, not permissible under any circumstances. Covering a sterile back table from later use is not permitted, because it is nearly impossible to uncover without contaminating the sterile items on the top of the table. Additionally, uncovering the table stirs up dust in the OR. Question 138. In which position would a patient be placed to counteract hypovolemia? Option A, left lateral. Option B, right lateral. Option C, Trendelenburg. Option D, reverse Trendelenburg. The correct answer is option C, Trendelenburg. Hypovolemia is low blood volume. Patients are placed in the Trendelenburg position to increase blood flow to the upper body. Question 139. Which of the following types of suture create the least tissue trauma and drag? Option A, swagged multifilament. Option B, swagged monofilament. Option C, threaded multifilament. Option D, threaded monofilament. The correct answer is option B, swagged monofilament. The use of monofilament suture swagged on a needle is best for minimizing tissue trauma and drag. Question 140. Which organization has legal oversight for the safety of healthcare providers in the workplace? Option A, EPA. Option B, CDC. Option C, DOSHA. Option D, NIOSH. The correct answer is option C, OSHA. The Occupational Safety and Health Administration, OSHA, is an organization dedicated to protecting the health of workers by establishing standards that address issues related to safety in the workplace. Question 141. Which level of Maslow's hierarchy of needs is most applicable to the surgical patient? Option A, esteem and prestige. Option B, love and belonging. Option C, safety and security. Option D, physiological and survival. The correct answer is option D, physiological and survival. Physiological and survival is the most applicable to the surgical patient. Question 142. Which of the following would be incorrect technique when removing the sterile gown and gloves? Option A, circulator unties gown. Option B, gown removed inside out. Option C, gloves removed inside out. Option D, gloves removed first. The correct answer is option D, gloves removed first. The gown is removed first by grasping it near the shoulders and pulling it off. The circulator aids the effort by untying the back of the gown. This action slightly turns the inside of the gloves outward to aid in removing them without touching any patient blood or body fluids that are on the outside of the gloves. Question 143. What type of procedure might require a laparoscopy combination drape? Option A, pilonidal cystectomy. Option B, subacromial decompression. Option C, abdominoperineal resection. Option D, femoral bypass. The correct answer is option C, abdominoperineal resection. A laparoscopy combination drape is a combination of laparotomy and perineal sheet. It is used for abdominoperineal resection. Question 144. Cell destruction by steam sterilization occurs by: Option A, cellular membrane damage. Option B, interrupt cellular division. Option C, altering cellular DNA. Option D, coagulation of protein. The correct answer is option D, coagulation of protein. The thermal, steam, destruction of microbes is due to the denaturation and coagulation of cellular protein and enzymes. Question 145. Which technique is not acceptable when draping? Option A, hold the drapes 12 inches above patient until over the draping site. Option B, protect gloved hand by cuffing end of drape over it. Option C, unfold drape before bringing up to the OR table. Option D, place drapes on dry area when setting up back table. The correct answer is option C, Unfold drape before bringing up to the OR table. Drapes are to be carried to the OR table in folded condition. If allowed to unfold, they could drag the floor, contaminating them. Question 146. A patient's fingernail polish is removed to: Option A, prevent surgical wound infection. Option B, allow temperature to be recorded. Option C, prevent ESU exit pathway. Option D, allow for use of pulse oximeter. The correct answer is option D, allow for use of pulse oximeter. The pulse oximeter cannot properly function with nail polish present. The light beam from the pulse oximeter is focused to travel through the nail and skin of the finger. Question 147. What is the purpose of maintaining the air exchange rate 15 to 20 times per hour in the OR? Option A, reduce microbial count. Option B, allow temperature to be recorded. Option C, provide comfortable environment. Option D, decrease static electricity. The correct answer is option A, reduce microbial count. Studies have shown that air exchange in the OR at the rate of 15 to 20 times per hour helps to reduce the microbial count. Question 148. How many ml of water is necessary to inflate a 5 ml balloon on the Foley indwelling catheter? Option A, 5. Option B, 10. Option C, 15. Option D, 20. The correct answer is option B, 10. 10 ml of water is necessary to inflate a 5 ml balloon on the Foley indwelling catheter. Question 149. If an ophthalmologist orders trimming of eyelashes, how is it safely performed? Option A, electric trimmer used on dry lashes. Option B, electric trimmer used on wet lashes. Option C, fine scissors without water-soluble gel. Option D, fine scissors coated with water-soluble gel. The correct answer is option D, fine scissors coated with water-soluble gel. Fine scissors coated with water-soluble gel is used for trimming eyelashes. Question 150. What is the correct technique for performing the surgical skin prep? Option A, incision site to periphery using circular motion. Option B, periphery to incision site using circular motion. Option C, incision site to periphery using back and forth motion. Option D, periphery to incision site using back and forth motion. The correct answer is option A, incision site to periphery using circular motion. When performing the patient's skin prep, the skin should be scrubbed and painted starting at the incision site using a circular motion. Question 151. The laboratory test that determines the ratio of erythrocytes to whole blood is: Option A, reticulocyte count. Option B, differential count. Option C, hematocrit. Option D, hemoglobin. The correct answer is option C, hematocrit. The percentage or ratio of erythrocytes that is present in the whole blood of the surgical patient is determined by the laboratory test called the hematocrit. Question 152. What is the proper procedure to follow when a pack of sponges contains an incorrect number after the patient has entered the OR? Option A, record actual number and use. Option B, hand off the sterile field and isolate. Option C, place on sterile back table and do not use. Option D, remove from the OR. The correct answer is option B, hand off the sterile field and isolate. If a sponge pack contains an incorrect number of sponges, the first scrub surgical technologist should hand the sponges to the circulator, who will place the sponges in an area of the OR where they will not be thrown away or mixed with other sponges until the end of the procedure and the OR is being cleaned. Question 153. Which of the following types of specimens would not be placed in a preservative solution? Option A, colon. Option B, calculi. Option C, tonsils. Option D, uterus. The correct answer is option B, calculi. Any type of stones, salivary, gallbladder or renal, should be sent dry to pathology. Preservative solutions destroy the stones, making it impossible for pathological examination. Question 154. Where should the surgical technologist begin when performing closing counts? Option A, back table. Option B, Mayo stand. Option C, off the field. Option D, operative field. The correct answer is option D, operative field. The first scrub should begin at the operative field first and work his way backwards: operative field, Mayo stand, back table, basin, sponge bucket, floor. Question 155. Which of the following catheter tips is used in a patient with a urethral stricture? Option A, olive. Option B, cadet. Option C, whistle. Option D, mushroom. The correct answer is option B, cadet. Cadet is a non-retaining catheter tip to maneuver around an obstruction if a patient has a urethral stricture. Question 156. Which type of procedure would require a stent dressing? Option A, neck. Option B, inguinal. Option C, extremity. Option D, abdominal. The correct answer is option A, neck. Bolster dressing, also referred to as stent dressings, are for wounds that are difficult to dress and keep in place, such as the face and neck. The long ends of sutures are tied over the dressing to secure it. Question 157. Which of the following is used in order to ensure preservation of the facial nerve during a parotidectomy? Option A, monopolar cautery. Option B, nerve stimulator. Option C, microscope. Option D, Doppler. The correct answer is option B, nerve stimulator. Nerve stimulators create very small electric currents that help to identify and preserve essential facial nerves. Question 158. Which of the following hemostatic agents is contraindicated for use in the presence of infection? Option A, topical thrombin. Option B, oxidized cellulose. Option C, absorbable gelatin. Option D, absorbable collagen. The correct answer is option D, absorbable collagen. Absorbable collagen is contraindicated in the presence of infection or in areas where blood or other body fluids have pooled. Question 159. During closure of a nephrectomy in the lateral position, the ortable is straightened to facilitate: Option A, proper circulation. Option B, wound hemostasis. Option C, adequate respirations. Option D, tissue approximation. The correct answer is option D, tissue approximation. To achieve proper wound closure, the table must be straightened to bring the tissue of the incision closer together and avoid tension on the suture and tissues. Question 160. Which of the following must be tested prior to the use of a fiber optic bronchoscope? Option A, light source. Option B, laser fiber. Option C, nitrogen level. Option D, a magnification lens. The correct answer is option A, light source. A fiber optic light source is the power source for all fiber optic instruments and equipment and should be tested prior to the use of a fiber optic bronchoscope. Question 161. Excision of a constricted segment of the aorta with reanastomosis is performed to correct: Option A, patent ductus arteriosus. Option B, coarctation of the aorta. Option C, aortic aneurysm. Option D, transportation of the great vessels. The correct answer is option B, coarctation of the aorta. Coarctation of the aorta can be corrected by excision of a constricted segment of the aorta with reanastomosis. Question 162. For which of the following diagnoses would a patient undergo endoscopic retrograde cholangiopancreatography? Option A, cholecystitis. Option B, cholecystolithiasis. Option C, pancreatitis. Option D, pancreatolithiasis. The correct answer is option B, cholecystolithiasis. An endoscopic retrograde cholangiopancreatography, ERCP, is performed to visualize the biliary and pancreatic tract so the patient would have the diagnosis of cholecystolithiasis. Question 163. The high ligation of the gonadal veins of the testes performed to reduce venous plexus congestion is A/N. Option A, spermatocolectomy. Option B, varicocelectomy. Option C, epididymectomy. Option D, vasovasostomy. The correct answer is option B, varicocelectomy. The high ligation of the gonadal veins of the testes done to reduce venous plexus congestion is a varicocelectomy. Question 164. The trauma to which two of the following cranial nerves would result in the loss of smell and vision? Option A, 1 and 2. Option B, I and 3. Option C, 2 and 3. Option D, 2 and 4. The correct answer is option A, 1 and 2. Surgical trauma to the first and second cranial nerves would cause loss of the sense of smell and sight. Question 165. Which of the following is performed for suspected ectopic pregnancy? Option A, choledocentesis. Option B, colposcopy. Option C, choledotomy. Option D, colporrhaphy. The correct answer is option A, choledocentesis. Choledocentesis is a diagnostic procedure performed for suspected ectopic pregnancy, intraperitoneal bleeding or tubovarian abscess. It involves the aspiration of blood, fluid or pus by needle via the posterior vaginal fornix. Question 166. Which of the following is a procedure for treatment of glaucoma? Option A, vitrectomy. Option B, iridectomy. Option C, enucleation. Option D, keratoplasty. The correct answer is option B, iridectomy. Glaucoma can be surgically treated by performing a goniotomy, iridectomy, or cyclodialysis. Question 167. What procedure is performed to correct chronic cerebral ischemia? Option A, rhizotomy. Option B, cranioplasty. Option C, arteriography. Option D, endarterectomy. The correct answer is option D, endarterectomy. Indications for a carotid endarterectomy include transient cerebral ischemia, asymptomatic Brught's, and chronic cerebral ischemia. Question 168. What procedure is performed to immobilize the jaw following a mandibular fracture? Option A, arch bar application. Option B, TMJ osteotomy. Option C, Lefort I. Option D, Lefort II. The correct answer is option A, arch bar application. Arch bar application is used to immobilize the jaw following a mandibular fracture. Question 169. Which of the following total arthroplasty procedures would require the postoperative use of an abduction splint? Option A, hip. Option B, knee. Option C, ankle. Option D, shoulder. The correct answer is option A, hip. An abduction splint is used to immobilize and keep in alignment the hip joint following a total hip arthroplasty. Question 170. Untreated acute otitis media may result in Option A, tonsillitis. Option B, mastoiditis. Option C, adenoiditis. Option D, ethmoiditis. The correct answer is option B, mastoiditis. Untreated acute otitis media can lead to mastoiditis. Question 171. Which of the following is used intraoperatively to assess vascular patency? Option A, position emission tomography. Option B, magnetic resonance imaging. Option C, computed tomography. Option D, Doppler ultrasound. The correct answer is option D, Doppler ultrasound. A Doppler ultrasound device is used intraoperatively to assess vascular patency. Question 172. The instrument shown below would be used during A. Option A, parotidectomy. Option B, tonsillectomy. Option C, rhytidectomy. Option D, stapedectomy. The correct answer is option B, tonsillectomy. The Herd dissector and pillar retractor are used during a tonsillectomy. Question 173. Which of the following is the body's primary source of energy? Option A, carbohydrates. Option B, vitamins. Option C, proteins. Option D, fats. The correct answer is option A, carbohydrates. The primary source of energy to the body is carbohydrates acquired through the ingestion of carbohydrates-rich foods and liquids. Question 174. What is compressed during rapid sequence induction and intubation? Option A, hyoid. Option B, manubrium. Option C, thyroid gland. Option D, cricoid cartilage. The correct answer is option D, cricoid cartilage. Selleck's maneuver or cricoid pressure is used to prevent aspiration during induction and ET tube placement. Question 175. What term refers to the spread of cancerous cells to other parts of the body? Option A, in situ. Option B, in vivo. Option C, metastasis. Option D, encapsulation. The correct answer is option C, metastasis. Metastasis is the spread of cancerous cells to other parts of the body. Question 176. The shared passageway for food and air is the Option A, trachea. Option B, larynx. Option C, pharynx. Option D, bronchus. The correct answer is option C, pharynx. The pharynx is a passageway for air and food.